What do you think? What do you think is going to happen over the next 12 months? What do you foresee?
For cyber clinic or just in technology in general?
Well, we'll talk about your vision for the future next, but just in general, yeah, I think what are you experiencing, and what do you foresee with cyber clinic over the next 12 months?
Yeah, look, I think in the more immediate future, we've got some some really significant plans from a feature dev point of view for the product itself. One of the key sort of feedbacks that we've been getting is really around the algorithm. So we're using a lot of that data to now work out where the matches are and how good they are, and what else we need, and what are the other things that we need to be asking patients to get a better fit. So part of our plan now is to develop what we call a dynamic algorithm, which will actually change and adjust the questions based on the responses that are being provided, and then accordingly get a better fit and a better match to practitioners. So that's an entire design that we've created, a clinical design around how that would work. But also it will give much finer data points to practitioners around their engagement and different levels of engagement as well, from personality styles of patients and practitioners, to be able to get a better fix on what is actually working and who's it working for. So that's generally, probably around, 12 months. But I think, the longer term vision for cyber clinic is really to move into machine learning. We're already doing some of that, and using AI more smartly, because I think the context in terms of health right now, and we're talking about the larger context of Australia as a whole, I don't really believe that the government has really harnessed the power of technology the way it should be doing it. Technology in its current form is changing rapidly. We're seeing the pace exponentially growing, and there's so much we can do with that technology. But really, the government, from a health perspective, has not really embedded technology into its framework, and they need to be doing a lot more. So part of our work is also to educate the government around that, based on our experience, based on the data that we get around what is actually working, what's not working, how machine learning can really help to develop the interaction, the engagement, the ease of access, and using voice analytics. So that's another area that we're sort of looking at quite heavily from an AI perspective. But really, ultimately, my vision for cyber clinic is really what I call precision therapy. So really being able to have us as practitioners provide really appropriate type of therapy, but being able to then predict which type of people need what types of therapy to get a particular types of outcome. And that entire series, from diagnosis to outcome, has never really been done before. And that's really our main goal, to get precision therapy into the key part of the mental health model, because I think that is going to be a real game changer. It's going to really impact on how the government funds, the types of Medicare rebates, also, being able to make a case for getting more sessions available for patients. We've already seen the government's increase the number of sessions from 10 to 20, but it's a one size fits all. So it's like, everyone can get access potentially to 20 sessions. But what about the people who need more? And there's no way for the government to really determine who actually does need more, who needs less, who's appropriate for particular types of therapy. And that's really our goal, is to develop the precision therapy model and embed that within the entire mental health ecosystem in Australia.
I totally relate to what you're describing there. There seems to be, it's quite amazing. I read something recently, I just can't think of the source of it at this point in time, but I read something recently that it's estimated by, give or take, 2022, that our smartphones are probably going to know more about our emotional state than our own family members. And so that's really, that's a real incredible innovation opportunity there, to actually be able to work through all those data points that can be developed or can be captured and are already being captured in essence by smart technology. I mean, whether it's the relationship between locations, how often we move around. I think I'm reading some studies at the moment that sort of talk about some of the issues that correlate highly towards depression, for example, when people don't have a certain frequency of movement, throughout the community, and that's highly relevant at the moment. So there seems to be some data points there that show that when people are more social and more interactive and move around more frequently, they tend to have less presentations of depression, as an example. So we're seeing this fantastic revolution, I guess, of opportunity around the idea of digital mental health and how that actually gets integrated and augmented into the therapy. And I just want to ask you about that in a sense. So the precision care model that you have in your mind's eye, that vision that you talk about, do you see that as being entirely within the framework of CyberClinic, or are you looking at also partnering or developing alliances with digital mental health tools that can actually facilitate that augmented therapeutic approach going forward?
Yeah, absolutely. I mean, as I said, look, my vision for CyberClinic is that it is a clinic. It's a super clinic, effectively, right? And so the idea in terms of the clinic is that our main focus is therapeutic outcomes for our patients, right? And so any system or model or technology that will allow us to do that is what we would be looking at. So there are biometric devices, for example, things that you can get on your you can use currently on your phone, right? You've got the health kits, etc., that give you all this data. So we would be looking at partnering with other sort of systems, technologies that are really forward thinking around this and how we could actually utilize that data to then get better outcomes. I think the key thing here is that there is a lot of, and this is part of sort of that the entire machine learning sort of component, but you get what we call structured data, unstructured data, and then you need to be able to sort of look at that or train the model. And part of the difficulty right now is that you are getting a lot of data, disparate data about different people for different things, and you can't match that data. So you don't have the entire patient journey to be able to say this is what will occur, and then compare all of that. So compare all those data points, and that's the big drawback currently from a precision therapy point of view. So if you want to say that we know, if someone comes in with a presentation of, let's say, 10 on a particular scale, depression scale, and then they get matched to this practitioner with this personality style, and they present with this style, they do X number of sessions, they should get this particular outcome. That entire journey doesn't exist because there's no way to capture that data. And that's really my vision for CyberClinic, that if we're able to get all of that information, of course, all anonymized data, then we will be able to create better models of care specifically tuned to the individual themselves, just like we're doing with medication now, right? That's exactly what we could be doing from a therapeutic point of view.
Absolutely, and I really think that that's a great explanation for the idea of a digital health therapeutic. It is that type of intervention. It is that type of alternative to, I guess, a way of relating to it is it's that precise intervention that we probably relate better to when we think about pills or injections. But when it comes to mental health, it's that behaviour, it's the change that happens within that individual over time. So being able to understand that and use the tools to bring it forward, I think it's a great vision. I think it's a fantastic vision.